The broadcast is now starting. All attendees are in listen-only mode.
Hi everyone, this is Alejandra and I want to welcome you to Child Health Specialty Clinic's webinar titled Vocational Rehabilitation and the Transition to Adulthood. Before we start, I do have a few housekeeping things to take care of. So we are able to offer continuing education credits for nurses and FPSS professionals who attend this live webinar. So if you're a nurse and want to receive credits for attending the webinar, make sure to complete the evaluation following this webinar. And this will allow me to keep track of who's seeking credits and then award credits at the end of the Transition to Adulthood webinar series. And if you attend this event, you'll receive 1 hour of credit. And if you're an FPSS professional looking to receive credit through the Iowa Board of Certification, please email me following this webinar so I can get a certificate made for you and sent your way. And for those that need a general certificate of participation, please also email me following the webinar and I can provide that to you. And more information about certification will be provided in a follow-up email with very clear directions on what to do. And I also ask that all attendees fill out the follow-up survey at the end of the webinar so we know what you guys all think about the Transition to Adulthood series and what we can improve upon. So now that the housekeeping things are out of the way, I'd like to introduce you to our presenter. So with us today is Mary Jackson. She's a resource manager for Iowa Vocational Rehabilitation Services. Mary has been working at IVRS for over 15 years and began as a vocational rehabilitation counselor in Waterloo. She obtained her master's degree in rehabilitation counseling from the University of Iowa in 2005. We're very happy to have Mary present today, and please feel free to type in any questions that you may have throughout the presentation in the question box at the bottom of your doc. And we'll save all the questions for the end, and I'll facilitate that conversation. So without further ado, I'd like to present Mary Jackson. And I'll just give Mary the presenter.
Thank you. Can you hear me okay?
Yep.
Sounds good. And can you see the PowerPoint?
Yes.
Okay, perfect. Well, thank you for that introduction. Like Alejandro said, my name is Mary Jackson, and I am the Transition Resource Manager with Iowa Vocational Rehabilitation Services. I started out as a counselor years ago and worked my way into my current role. So I've had a few various roles within VR, which has all helped me in my current role. So to get started, I just want to talk a little bit about our agency overall. We are also known as IVRS or VR. So you may hear us referred to as that throughout the state. But our mission is that we provide expert, individualized services to Iowans with disabilities to achieve their independence through successful employment and economic support. And so our vision really is to make sure that we're making a positive difference for every person, one person at a time. We can begin working with individuals as young as 14 at IVRS, and we really have no age limit. So we are willing to work with anyone who has a disability that is wanting to go back to work. For the purposes of this presentation, I'm going to focus on our students and youth with disabilities. So I think it's really important to understand from a historical perspective how VR has changed over the last several years. So something was passed known as WIOA, or the Workforce Innovation and Opportunity Act, and that was signed into effect back in July of 2014. This really changed the face of VR, and it really has impacted how we deliver services to our transition-aged youth. It has really opened up the capacity of who we're able to work with. So I'm not sure how many of you are familiar with VR, but if you recall in the past, so pre-WIOA or pre-2014, a student would actually have to apply for our services, be determined eligible, come off the waiting list, and then we were able to work with them and develop their employment plan and move forward with services. Well, with WIOA, we've had a lot of changes with how that process looks. We have a lot of new language. I have some of that here known as PE, IVRS eligible, and pre-ETS, and I'm going to go over each of those in the following slides. But I just really wanted to make you guys aware of this legislation. If you are interested in learning more, on our website, and I have it on the PowerPoint linked later on, On our website, we do have webinars that we've done on WIOA that really talks about the impact on schools and on VR services and how services have changed over the years and how we're changing is a positive when it comes to students with disabilities. You'll see that hopefully in the next couple of slides. The main point behind WIOA, though, it's really that philosophy that everyone can work, and it's finding the right supports to move forward with how that individual can achieve their employment goal. Again, with what we're focusing in on for this presentation, I'm going to be talking about how we're determining those supports that are needed and what those opportunities look like for students with disabilities. So one of the new terms that came out of the legislation was PE or potentially eligible. So this is referring to any student with a disability who would be between the ages of 14 up until about the age of 22, who is currently on an IEP or covered under the provisions of 504. So they could be on a 504 plan, or maybe they're just regarded as having a disability because there's other disability documentation, but they're not on a 504 plan, that they would be considered potentially eligible for our services. So regardless if the student has actually applied for VR services, so filling out an application is when they've actually applied for services. Prior to that, any student with a disability is considered potentially eligible. They do have to be in a recognized educational program to meet that definition of student with a disability. And so that would be obviously a student in high school. High school itself is a recognized educational program. We have some students who are homeschooled. That is considered a recognized educational program as well. We also have students that are in college in the post-secondary setting. That is also considered a recognized educational program. So when I say students, I'm referring to anyone ages 14 all the way up until 22 that would be in one of those recognized educational programs. Now, of course, we can still work with individuals beyond the age of 22. They just don't meet that definition of student with a disability. That's important to know later on, because when I start talking about pre-ETS or pre-employment transition services, it impacts whether you're a student or not with our agency. So again, we've got the group known as potentially eligible, and you can see how that really has changed our capacity and who we're able to serve and work with. So it's been a positive, and we're able to work with more individuals even before they've applied for our services, which is great. It also has some challenges where we have had some capacity issues. Because of that, we have developed a lot of transition programs across the state, which in my role, I do oversee those programs. So those would be things like the Transition Alliance program, otherwise known as TAP. We have that program in about 17 districts across the state. We have a program known as TEAM. That's actually in our Des Moines public area. I'll describe a little bit later on how you will find out if a high school that you're working with has a contracted program, but that's why we've developed all of these contracted programs, as it's really expanded who we're able to work with. IVRS eligible, that's the other group of students and individuals that we're working with. So we have students who are potentially eligible, but as we're working with them, we're starting to identify there could be some significant barriers that maybe this individual needs individualized services through VR, and they're going to need some long-term supports to be successful with employment. Those are the students then that we work with and encourage to apply for VR services. Once they apply for services, again, I'll go through that process a little bit later on, but once they're determined eligible, now they're considered an IVRS eligible student that we're working with, and the services do look a little bit different when you reach that point in time. So pre-ETS, otherwise known as pre-employment transition services. This, again, is a new term that came out of the WIOA legislation. This really impacted, obviously, students with disabilities. So both groups that I just mentioned, the potentially eligible and the IVRS eligible, can all participate in pre-ETS as long as they meet that definition of student with a disability. So these are these high school students that we're working with. These are the students in the post-secondary setting that are in college up until that age of 22. They can all participate in pre-ETS. So pre-employment transition services, these are designed at career exploration at an early stage. This is really meant to explore all the different opportunities that are available. Historically, pre-WIOA, we would say a lot of students maybe were quote unquote pigeonholed into certain fields and really didn't explore options available. Maybe they don't know what's available. Maybe all they had access to was what their parents had been doing. The philosophy behind WIOA is to make sure that we are offering all types of opportunities to these students. So they're getting the same offerings as students who do not have disabilities. We want to make sure that when they come to their career decision, that they're making an informed decision. And really, the only way to make an informed decision is when you know what else is out there and what is offered. So when you look at pre-ETS, it's an overarching umbrella where we have 3 different categories under it. It's required activities, coordinated activities, and authorized activities. What I'm going to talk about here today are these required activities, and this is what you see on the screen right now. These 5 areas are really the heart of the pre-ETS. So this is where we're directly working with students and providing opportunities. Job exploration counseling. That's exactly what it sounds like. These are things such as we have panels of employers who come in to talk about what types of jobs they have to offer at their place of employment. We might be doing different activities with students to engage in learning about labor market information. If we have a student that says, you know what, I really want to live in the state of Iowa, but I want to be a marine biologist. Well, if you look at labor market information, pretty limited, if any, jobs that are going to be available in Iowa with that type of degree. So if you're planning to stay in the state of Iowa, that might not be the route that you're wanting to go. Otherwise, it might be exploring, are you willing to leave the state of Iowa and what those opportunities look like? That all falls under job exploration counseling. Work-based learning experiences. These are these hands-on experiences out in the community. We want to get students out there on job shadows. We want to make sure that they're doing informational interviews with employers to learn more about the jobs. This could be short-term paid work experiences out in the community. It's really those hands-on experiences out in that community environment with the employer. We set these up. We work very collaboratively with high schools as well to help arrange these. A lot of high schools have work-based learning experiences or work experience programs that they have available. A lot of those focus on those non-paid experiences. I would say from VR standpoint, we're really focused on the paid work experience. So we collaborate with those districts to make sure that those programmings are in place. And when the student really is ready to get out there, we want to make sure that we're there to assist with getting these experiences set up for them. They may need supports in being successful with this. And again, we collaborate with the districts to make sure those supports are in place. So whether that's instructional training or job coaching or whatever that's going to look like for that student, we're going to work very closely with their IEP team to make sure they have those supports in place to be successful with that work-based learning experience. Counseling and opportunities. This is taking a look at what is available at the post-secondary level. We have a lot of students that are interested in college, but maybe aren't sure what degree program is the best option for them. So maybe it's taking a look at what that college has to offer. Which college is going to be the best fit? If they have a specific disability and maybe there's a college that works better or has more accessibility for that type of disability, we want to make sure we're exploring all those different opportunities. We also have students that may be apprenticeships where it's more of a hands-on training is more appropriate. We have other students that maybe on the job training opportunities are more appropriate for them, or the better route to go for that type of degree or for that type of employment situation. So we want to make sure that we're exploring all the options and match the student up with the best training program that's going to suit whatever those needs are. Workplace readiness training, exactly what it sounds like. We are working on those soft and hard skills. We want to make sure those students understand, you know, if I have a cell phone on the job, probably not appropriate to pull it out and text at all times during the job. Could be it's more appropriate during your lunch hour to use your cell phone. And maybe this is their first job and they've never encountered this before. And so we're going over this type of information with them. It could be something as simple as understanding they need to set an alarm so they get up in enough time to be able to get ready for the job, drive to the job, and make it there in time to check in on whatever their employment is going to be. So it's learning all those skills. It's all that training that's needed for them to be successful in their future career. Self-advocacy instruction. That is making sure that that individual understands their rights and responsibilities as a person with a disability. So we work with students a lot of times to empower them to make sure they have the skill sets to, for example, lead their own IEP meeting. So maybe they don't start out that way when they're first working with our agency, but maybe over time by senior year in high school, they're able to lead their own meeting. It could be maybe we did an assessment with the student, and at their IEP meeting, we want to go over and share with their team or their 504 plan team on what that assessment result was. So maybe the student's going to share a part of that with the team. But it's really working on them understanding what their disability is and how that's going to impact them in terms of work for the future. It's also going to make sure that they not only understand the differences between accommodations and modifications at the high school level versus post-secondary, but if for self-advocacy instruction, we need to make sure the student understands that when they're at the post-secondary level, they're the ones advocating for themselves. They're the ones that are going to need to approach that professor or that teacher and make sure those accommodations are in place. That's the type of training and the instruction when we talk about self-advocacy instruction that we work on with those high school students. There's lots of examples of pre-ets that are happening across the state. So if you guys are interested, we have a YouTube channel that shares some of those stories and some of the events that have happened. We have many more examples that I certainly don't have enough time to talk about today. But just to give you guys an idea, we deliver these all throughout the school year. So we collaborate very closely with districts and just determine what pre-ets activities we will be doing. It looks different because every district has different programming. So we're not going to duplicate anything the district is already doing. Everything we focus on is new and expanded services. So it's really taking a look at and the collaboration between what is currently happening and how we can expand those efforts. So just for an example, we had a district that was working on interviewing skills, has a great class where they are going over the skills and focusing in on students with disabilities in this class and really practicing those skills. But there was no community connection. There was no employer coming in and working with those students and actually giving them an opportunity to be in a mock interview situation with an actual employer. So under pre-ets and with that district, what we focused in on was connecting them with our business contacts and setting up and arranging some of those interviews. Some students went out to the job site to do those interviews. Other times employers were coming into the high school. And so we were connecting and making those connections and having those opportunities happen so the students could take the skills they just learned with their teacher in that classroom setting and apply them in a real life experience. Again, that's just one example. We also do things year-round. So Voc Rehab is a year-round program, and so we offer many activities over the summer. So this past summer, because of COVID-19, looked a little bit different than in years past. A lot of times we have academies or different summer programming happening across the state, and it's very hands-on, typically in person where we're delivering those activities and getting students out on those employment sites. This summer, we did everything virtual because of COVID-19, but we also learned a lot that there are some students that do benefit from the virtual learning. And so some of those experiences will continue to be virtual, but we're hoping this upcoming summer we can continue those in-person experiences and have those hands-on opportunities. So the students that we're working with are working year-round with us and are working on these pre-ets activities. Lots of opportunities during the summer. So if you guys are working with students who are connected to VR or who you want to get connected for these pre-ets activities, just know that there's opportunities year-round. We know that some students are very busy during the school year, and so sometimes they're chances to work with VR in the classroom is limited depending on what their class schedule looks like. So we collaborate with schools and we actually go in during the school day during different designated hours to provide these activities. Some students, because of their schedule, maybe can't access them. So we can work with students after school. We can work on them one-on-one to deliver them. And there's also the summer as well that they have opportunities to participate in all of these activities that are occurring. So maybe you're wondering at this point, how can I get the student that I'm working with involved in some of these pre-ets activities? The main thing that we have available to get students connected is this pre-ets agreement. So the pre-ets agreement is needed before a student would participate in that first pre-ets activity with VR. Especially if no employment plan has been developed. So this is really that potentially eligible group that I talked about. That runs all the way up until we determine eligibility for our services. So anyone considered potentially eligible would need to have a pre-ets agreement in place. And what this really is this is not applying for services at this point. So there is some confusion there. So I want to make that clear. This is agreeing that you want to participate in these activities. You're acknowledging that you are a student with a disability, or my child is an individual with a disability, and I want them to participate in all of these pre-ets activities activities that VR has to offer in my school district. The PREATS agreement is actually linked right on here. So I will send this PowerPoint out to Alejandro when we are done and make sure that you guys have access to this. It links it directly to our agreement. Anyone can fill this out. It's right on our website. So we have students that fill it out. We have families that fill it out, teachers, healthcare providers. Anyone can fill it out. We do make sure the student has to sign off on it and the parent if the individual is under the age of 18 or over the age of 18 with a legal guardian, because we want everyone to make sure that they are on board in an agreement that they want their student to participate in these services. But this is how you would get a student connected. And again, it's not an application for services, but it is an agreement saying that, yes, we are interested in participating in the activities, not only that are offered during the school year in my district, but also during that summertime programming. So applying for services, like I mentioned before, we have the group known as potentially eligible. As we are working with these students, we start to identify students that are having issues. So let's say we have a student participate in an activity and we notice they're really having a hard time staying on task. Maybe we're giving them a lot of prompts, a lot of reminders to, hey, this is what we're doing now, and trying to keep them involved and engaged in the activity. These are going to be some of our red flags that we take a look for, some of the triggers. So as we're watching for these, we start talking with teachers, we start talking with parents and families and saying, we think that this student could probably benefit from our services and here's why. And we start sharing some of the information with them. Applying for services can also be a teacher has a student in the classroom. Maybe they haven't been connected yet for our pre-ETS activities, and they've been working with them and identify this student has significant limitations and is going to need support to be placed in a future employment situation and any type of post-secondary training, also with their employment situation. Then those teachers are referring students to us. So we do have a referral form on our website. There's also the intake application as well. That's all linked right here again in the PowerPoint, so you guys have access to it. So if you are working with an individual and know this person is going to need assistance, they have significant limitations, we know they're going to need assistance with future employment, you may want to start with just applying for VR services, especially if they haven't been connected. Maybe you're not in contact with the local district, aren't really sure what's happening in terms of pre-ETS, so it might be difficult to fill out that pre-ETS agreement at that point in time. Maybe it's the application you want to start. And so this is where the individual or yourself could meet with the individual. You can start applying for services. You could also fill out the referral form. And that, as long as we have the individual's first name, last name, date of birth, and know they're interested in services, we can meet with them and complete the rest of the application. So we don't want people to feel like they have to fill all of this out. They can start the process, reach out to us. As a healthcare agency, if you guys are working with students, you could pick up the phone and call our agency. We have an email link on our website as well, that if you wanted to refer someone, you could email us that way, and then we would get you connected with the local area office. So any of those ways would get a student or an individual connected to our services. But the intake process itself, once we know somebody is interested in services, we'll meet with them and get the process started. So again, if they need help filling out the rest of the application, we will do that during that first initial meeting. We also have other forms that we fill out. We are filling out releases of information. We do have to verify that an individual has a disability and that it impacts one of the 7 different areas that we take a look at. So the 7 areas that we do look at for eligibility include mobility, work skills, self-direction, self-care, interpersonal skills, communication, and work tolerance. Again, this is all posted on our website, but feel free if you guys have any additional questions about those areas in the chat. But we have 60 days. So once we start the intake process with someone, we meet with them, we fill out all the documentation, we're going to send out for medical records. We're also going to talk with the districts. We're going to get copies of IEPs, 504 plans, any type of provider, if they have a mental health provider, if they have any other information to share with us. This is our time. We have 60 days to gather all this information, take a look at it, and determine if there are any significant limitations that they could benefit from our services. If they are, obviously that's done within 60 days. We can do extensions to this for extenuating circumstances, but our goal is to get these done within 60 days. So as a healthcare provider, if you're referring a student, you would just want to be prepared if they're seeing you guys for a disabling condition and you have information to share, we would be signing that release with them, getting that to you, and we would just expect you guys to send that as soon as possible so we could determine their eligibility. And of course, we do parent feedback. We always follow up with teachers, students themselves, and any other providers if we have any questions or need additional information to determine eligibility for students. We do have a waiting list. So once eligibility is determined, a student will either become most significant disabled on that category, and that's also known as MSD. In order to fall in that area, you would have to have 3 or more significant limitations in those areas that I just mentioned previously. So 3 of the 7 would have to have significant limitations. The second waiting list category is known as significantly disabled, or SD. That waiting list, you would have to have 1 or 2 of the 7 areas with significant limitations identified. Others eligible, that's an individual where we acknowledge they have a disabling condition and there's some barriers there, but they don't have any significant barriers in any of the 7 areas that I mentioned. So it's really important to know where an individual falls. MSD right now, the wait time for that is pretty much immediate. So as soon as eligibility is determined, they're coming right off the waiting list the same day. The SD category, that wait time is approximately a few weeks to maybe a month right now. And keep in mind, this does fluctuate. So we do have a budget team that meets and they determine how often and when people are coming off the waiting list. So MSD has remained pretty consistent with having a very, very short wait time and coming off immediately, and that's been for the last few years. SDs fluctuates between a few weeks to a few months, typically. Now, others eligible. That is a waiting list category that's been closed for a few years now. So if a student fell on the others eligible waiting list, they would still be able to participate in the pre-ETS activities that we have available as long as they started participating in those before they go on the waiting list. And that's the model that we do follow with students, is getting them connected. So even if they haven't participated in pre-ETS as potentially eligible, as soon as they apply for services, we would want them to start participating in those pre-ETS activities, because then they can continue those while they're on the waiting list. And really, if a student fell in others eligible, that's probably the extent of the services that they would be able to receive at this point, because it is a closed waiting list and we don't know if or when that waiting list would open up in the future. So it is really important for those students, especially that fall in that category. So after a student comes off the waiting list, again, varies depending on which one they fall on, varies depending on the amount of time. But once an individual comes off the waiting list, we have 90 days to develop an employment plan with this individual. With students, we can make this as broad as we need to. So we have a goal known as competitive integrated employment. So a lot of times we have students that come to us that say, I have no idea what I want to be when I grow up. And you know what? That's fine. We will work with them to help them figure that out. So within those 90 days, we're doing assessments with the students to help identify maybe some areas of interest. We're doing interest inventories. Maybe we're setting up some job shadows. We're doing all kinds of things with the student. And maybe still at the end of that, the student says, I still don't know what I want to do. Totally fine. Let's write that goal as broad as we can, which could be competitive integrated employment. And now let's identify some additional services we need to do to help them figure out what they want that specific employment goal to be. We work with students. By the time they graduate high school, they need to have that specific employment goal identified. Now we can start working with somebody senior year. Of course, we like to get the referrals as early as possible, but sometimes we get connected later on. Maybe a student comes to us senior year and says, this is what I want to do. I know this is what I want to do. And so maybe in those 90 days, we're just hammering out some of those details and can go ahead and get that plan developed. Now within that plan, that's where we're going to list off the individualized services that they need to be successful with employment in the future. So it could be continued assessments. Maybe we need more time and want to do some more assessing with the student. That's fine. That could be written in. Maybe there's counseling and guidance we need to do. Our VR counselors are trained to be able to provide that counseling and guidance to help steer that student in the right direction in terms of what type of career or employment situation would meet their needs. We have things such as self-employment options. So we have some students, again, through pre-ETS, they're going to explore all the different types of options that are available in terms of employment. So whether they want to work for an employer or maybe they want to work for themselves and really understand what that's going to take, we're going to work with them through that. And we have a self-employment program. We can help them be successful with setting up their own business. We found several students, for example, we had a student with autism, had very significant needs, had a really hard time working for somebody else. And so we ended up working with them through our self-employment program, where we worked very closely with our business development specialists and our ISE specialists, and they helped him start his own business. He had some great family support. We were able to network through that, and he's been very successfully employed running his own fire starter business. Other types of supports or services that we might write into somebody's employment plan could include training. Maybe a student is planning to go on to the post-secondary level. Let's say we have a student that is wanting to be a doctor. Obviously, in order to be a doctor, there is going to be some post-secondary training involved in that. And in order to reach that point, maybe they're going to start out at a community college like DMAC. Maybe they plan to transfer to UNI after that, or to the U of I, and then on to a doctorate degree program. We will work with that individual throughout that entire program. We have tuition assistance available to help them pay for college. We have assistance available to help pay for the books. We have assistance available to help them get connected to disability services on campus. We want to make sure that they have the supports in place, any accommodations that they need to be successful. We, of course, want the individual to be as independent as possible, but we all know when you're transitioning to the post-secondary level, there's some assistance that's going to be needed, especially in the first couple years, to make sure that is a smooth transition. In our staff, we have staff located at every community college across the state. We also have staff located at every region college across the state. We cover all the private colleges. We may or may not have somebody right there on campus, but we have somebody assigned to the college who goes out to the campus to meet with the students then. So we will work one-on-one to make sure that individual gets successfully through that training program and gets the services or whatever supports they need to be successful in that post-secondary setting. We also have services called supported employment services. We have some students that have really significant needs and may need things like job coaching. They might need some customized employment situations where maybe we're going to carve out a position for them to be successful, and they're going to need a job coach on site. So we work and partner with agencies called community rehabilitation providers, also known as CRPs. These programs we contract with for some of these services. So we will work with our business contacts to help get them placed. We also have business development specialists at those CRPs that we contract with to work very closely and help with the job carving. They also provide the job coaching as well. We make sure they have all the appropriate certifications that they need under CARF or any other type of certification, and then we set up contracts with them to help get individuals placed so they have the right supports and services that they need. We work very closely with waiver programs and waiver funding as well, because once we close somebody out of services, they may need those long-term supports continuing on into that extended situation. So we work with the individuals to make sure waiver is in place or whatever funding and supports need to be in place to help fund those maybe after VR is out of the picture. We also assist with rehabilitation technology. There could be AT that a student needs to be successful. We've had many students have access to technology in the secondary level, but that technology doesn't go with them when they graduate. So we begin working with and helping identify, are there things like the smart pen? Is there an iPad? Is there some sort of assistive technology device that they need due to their disability to be successful? And so we want to make sure that they have that. So we will do analysis with them to help determine what that technology that would be the most appropriate for them. And then we also help with some of the costs behind that. Obviously, job placement. Our ultimate goal is to help individuals get on their long-term career job before we ever exit them out of services. So job placement is obviously a main service of ours. So when it comes to students in high school or youth that we're working with, we might begin working with them at age 14. We're going to follow them all throughout high school, providing those pre-ETS activities, any other individualized activities that that student needs to be successful if they have an open VR file. Maybe they graduate and get placed right away in employment. If that's the case, we'll work with them until they're stabilized on the job. and then we wait 90 days before we would close them out of VR services. It could be that student graduates high school and, like I described, is going on to post-secondary setting. We will continue to work with that student throughout that post-secondary setting. Once they graduate the training program, then again, we would make sure we would help them with their placement within the business, make sure they have whatever accommodations that they would need in place. And then once they're stabilized, after 90 days of stabilization, we would exit them from our services. That's our ultimate outcome at VR, is getting people to the point that they are independent as much as possible, or have the supports that they need, like a job coach, in place, and their job is stabilized before we could exit them from services. So from that description, you can see we work with students and individuals for many years. Sometimes it's a shorter period of time, like that senior I described. Maybe we start senior year, and within a year or two, they're placed on that career job. Things are great, and they're exiting from our services. We will work with them. There's no time period that says it has to be completed within a year or 5 years. We're going to work with that person to make sure they're making reasonable progress on whatever their goals are, but we're going to keep working with them until they're successfully placed on the job at least 90 days before we close them out of our services. We also have a service I want to mention called benefits counseling. So we have a lot of students and individuals on Social Security benefits. And so a lot of times they're wondering, well, I don't know if I can work, or I don't know how working is going to affect my benefits. I don't want to lose my benefit, or I'm scared to lose my benefit. So we have trained benefits counselors across the state who will work with students and families to help identify and explain how benefits are impacted if they were to get a job. So we work with them and actually we start with that activity way back even in pre-ETS, providing generalized information on how benefits are impacted, because we really want people making an informed decision to know you can work and still receive benefits, or you could work and go off of benefits. There's lots of benefits in place to help people be successful in that type of situation. So we want to make sure that we have them set up and make sure that they're making an informed decision on whatever that career option is, and that to make sure if they are nervous or scared, that they do understand that there are safety nets in place, and our benefits counselor will help them get through that process. So maybe at this point, you might be wondering, well, gosh, that's a lot of information and a lot of services that are occurring. And so I'm not really sure what's happening with some of the school districts maybe that you're working with, or that your students that you're working with, what the school that they go to, what they have to offer. So I wanted to mention our local school plans. So across the state, like I said, we have staff assigned to every high school across the state. We work with every public high school and every private accredited high school. We also do work with homeschooling students as well. But in school systems, we develop local school plans. These are due every year by November 1st, and we share these out. So if somebody was to contact me and say, I have individuals at Lincoln High School in Des Moines, and I want to know what types of services that we have to offer, what type of programming that they have to offer at that school, we would send them a copy of the local school plan. This is available for parents. It's available for teachers, healthcare providers, anyone that we're working with that just wants to know what's happening in the district. So when I mentioned earlier that we have contracted programs, some of those transition programs like TAP, those are all identified on these local school plans. So the school itself identifies the type of transition program that they have available. So maybe they have some career classes, maybe they have a work experience program or some other opportunities for students. That's identified on the plan. We have a column then for VR services, where we're identifying the new and expanded services that VR has to offer in that district. Then we also have other columns identified if we have other community partners involved. We have some CRPs that are very heavily involved in some of our districts. They would be identifying the type of programming that they have to offer in that school district. If one of our contracted programs, like TAP, is in that district, that's going to be identified on that plan, and it's going to list out what they have to offer. So it's really, we're trying to find a way to not duplicate all these services, because there's a lot of things, if you're familiar with IDEA, that you probably see a lot of overlap between what I described for pre-ETS and what's available in IDEA. So it's really important that we work together with the districts and collaborate so we all know what's going on, and that we're making sure that students have access to all of these services and all those pre-ETS areas. But we need to make sure if the district has a really great program, we're not going to go in and duplicate that. We might look at a different area. Maybe they're doing really good in job exploration counseling, but maybe those work-based learning experiences, we need some more opportunities there. So maybe in that district, that's where we're going to focus from VR's angle on making sure that there's more work-based learning opportunities available. So it's really important. Again, I wanted to mention these local school plans. As you're working with students at high schools, you guys can request copies of these. Students and families can request copies. We always want family feedback. And something that we're gonna actually, we were supposed to incorporate it this year, but because of COVID-19, it's been delayed, so it'll be next year. We are gonna start surveying families, school staff, VR staff, to make sure people are understanding what their local school plan says, to make sure they're a part of those planning discussions. So it's not like a one and done meeting, but it's meetings that happen over time and the plan can evolve. Every year, these are redone, and every year the plan is looked at to see, did this work, did it not work? We want to make sure we're getting family feedback on this, because maybe families have an opinion on how the summer programming went, or maybe how services are being delivered. Maybe we're not accessing all of the students and that we should, and so we want to make sure all that feedback is incorporated back in. So we will be starting a survey that will go into effect next school year to start getting more feedback. But I do present, so I'm on a statewide panel where we have parent representation on this panel, and we take things like this to that panel to get feedback on, this is what the plan looks like. Are you getting access to this? Are you guys having feedback that you're providing in your districts? So we do have a mechanism to get family feedback right now, but we are trying to beef that up by allowing that survey to happen next school year, hopefully, is when that will happen. But these local teams meet. And so again, if any of you on here want a copy of a plan for a district that you're involved with, all you would need to do is email me. If you are familiar with the VR counselor who covers the district, you can always email that counselor. I did want to point out on our website, we do have a list of all of the high schools that are covered across the state, and the VR counselor that covers that high school. So you could contact that individual directly. That's right on our website, on our high school student tab. There's a high school contact list on there that you can click on, and it will pop up every school that we're serving and who the individual is that's working with that district. So again, you could contact them directly for a copy of that plan, or you can always reach out to me. All the plans have to be submitted to me by November 1st. Again, this is just a great way to find out what's happening in districts that maybe you're working with across the state. So I know I've been talking a lot up to this point in time. I'm not sure if there are any questions or not. I have not been following chat, so I'm going to rely on Alejandra for that. But I did want to point out, this is our website on here, www.ivrs.iowa.gov. And that has a lot of the information that I referred to on there, but I thought I would open it up for any questions.
Thanks, Mary. We really appreciate it. We do have one question in the question box. Do you guys have any brochures or business cards for us to give information, to give families with information?
We do, yes. All of our counselors across the state, we do have a specific transition brochure that describes all of the pre-ETS activities that I just mentioned. I can actually email that along with the presentation to you if you want, Alejandra. I have that in the PDF format, but there are paper copies as well. Every area office across the state, so we have 13 area offices, they all have those brochures as well. Every VR counselor would have business cards too, so we could certainly get any of that information to you guys that you would need.
Awesome, thank you. If you guys too, if the attendees want to raise their hand, I can unmute you if you want to answer the question or ask a question verbally. And while they do that, I did have a question from someone from before the presentation. And the question was, do you guys have any services for non-English speaking families?
Yeah, so our services, great question, are based on disability. So when we take a look at eligibility for our program, we are basing that on the disability. However, if somebody with a disability, English is not their first language, or maybe the family, English is not their first language, we do have we have interpreters that we bring in to help with that. So yes, we would still definitely serve them. We don't determine them eligible based on them not speaking English as their first language, but we have interpreters that we would pay for to come in so that we could still communicate and still make sure the forms and everything, they are understanding everything for services. We would cover the cost of all of that for them to participate.
Awesome. Thank you.
And I did just want to mention, now that I mentioned cost, I'm not sure if I covered this earlier or not. We are a state agency, so we do receive state and federal funding for our agency. So there is actually no cost to participate in our services. We do get that question a lot. People think, well, how much is it a month, to be involved with your services? There's no fee to be involved with us. We are a state agency. We are state and federally funded for certain particular purchases that we make. So for example, we have somebody that might need assistance with hearing aids. We do a financial inventory when we make that purchase, where maybe based on their income, they might have to pay 5% of the cost of the hearing aid, or maybe 10%. But there's no actual fee to participate in our services.
Thank you for clarifying that.
No problem.
Another question that we had was that, so as you may or may not know, a lot of our regional centers are located in more rural areas, as well as our patients. So what kind of vocational rehabilitation services, or what do Voc Rehab services look like in these areas? I know that you had mentioned that each school has a staff member, but are there anything else that target specifically rural areas?
Yep. So we do have some contracted programs that cover our rural areas. We have every county is covered by VR. So we have staff assigned, like we mentioned earlier, to every high school and every county across the state. So when it comes to the rural areas, for example, in the Galva-Holstein area, we actually have a Galva-Holstein TAP that covers 9 different small districts up there, and the staff go around to each of those districts and provide the services that I mentioned. So those pre-ETS activities and then some of those individualized services. They're going out and working very closely in that district to provide that. So our summer programming as well, that occurs all over the state. And so when we see a need in an area, we might have it centrally located in some spots, and in other spots, we're going out and holding smaller summer programming with those areas in the rural counties for Iowa. I know this last summer, we actually saw a bigger participation in some of our rural areas through the virtual learning, because they had access to the internet and they were able to see other parts of Iowa, and they actually were logging in to that because they wanted to see that, and maybe they didn't have the opportunity to travel across the state. So that was another way that we are able to connect with students, obviously, is we have a lot of virtual activities going on right now. And so we just need to make sure that they have access to the internet in those rural areas. But our activities would look the same across the state. So everything I described would have to be provided in any district, whether it would be rural or more of an urban area.
Great. Thank you.
Mm-hmm.
And then maybe while we wait for some more questions, I did have another one from a participant. I know that you had mentioned that because due to COVID-19, being virtual can be a benefit to a lot of people, but have you found any barriers in establishing Voc Rehab services in the midst of COVID-19?
Sure. So I would say, great question. I would say our biggest barrier was during the school year, the students had access to technology. Many more students had access to technology because they had maybe the tablet or the Chromebook or the laptop that the school had issued. Then over the summer, we saw maybe some decline because they didn't have access to that. So we definitely are going to have Now that the school year has started again, most of our students now have technology again because the schools issue it. So we are working very closely with school districts. We did also this past summer talk with districts where they actually allowed the student to keep that technology over the summer so they could participate in our summer programming. So when I say it's a collaboration, it definitely is. We work very closely with our districts. When they know students will be participating in the summer programming, they allowed them to keep that technology to still be able to access the internet. So that was helpful. It was a barrier at first we weren't anticipating because, you know, we thought, oh, they have the tablet, but then all of a sudden students were turning it in at the end of the school year. So it was a bit of a barrier at first, but we worked with the districts and we were able to work out to get internet access and them to be able to utilize that tablet so they could continue to participate in those activities this past summer.
Great. And I have one more question on my list before I open it up to anyone else, if anyone else has any questions. But you had mentioned that you were on a panel where you get a lot of family feedback. What kind of family feedback are you finding when it comes to voc rehab services in Iowa?
Great question. It's interesting because the feedback that we've gotten in some areas is that the services are going great. They're aware of the plan, and in some other areas, maybe the services aren't going as well. So that's what we're trying to target and know who to provide technical assistance to. So we received feedback from a family that said they really wanted the services and the student to participate in them, but maybe there was a barrier with the VR counselor being able to get into the school. Maybe we didn't have the best relationship with that district at that point in time. And so that became aware to us that we needed to work on that with that particular district so that we could build services. It also helped us identify where maybe we had gaps in services. So I mentioned our transition programs. That's really how our transition programs are developed. When we identify that there are a gap in services, and whether that's through the family panel that I'm a part of or through discussions with districts, that's when we start to talk and say, is there a program that we could develop to meet the needs to fill these gaps in this community? And so that's how TAP was born. We have a program known as Making the Grade. We have a program known as Team within Des Moines Public. That's really how all those were born, was it's through those discussions, finding out where our gaps are occurring, and then trying to brainstorm and work together as a team to fill those gaps, whether it's something the district could be doing, or if it's something that VR needs to do, or something we do collaboratively. Like our TAP program is a collaborative effort between the school district and VR. It's 50% funded by the school district and 50% funded by VR. So that it's through those discussions that we identify those gaps. And then we also identify consistency of services across the state. Is there additional training that needs to happen? Are activities occurring or are services occurring the way they should? And if not, how do we fix that? And so it's through those, and they're great discussions. And we go in definitely with an open mind, and we want to hear from the parent perspective that maybe activities are happening, but why are the activities not being available to these particular groups of students? And so it's working with the district to make sure that access of services are also happening throughout the school day as well as during the summertime. So it really helps us identify where those gaps are. And then we work with the families and the schools to help pretty much come up with a solution on how to fix that.
Thank you for that answer. We also have another question from Renee, which is one of our family navigators at CHSC. Her question is, how have you put goals in the IEP related to VR, but doing it remotely due to COVID-19?
Sure. So we don't actually write IEP goals because obviously that would be the teacher's role through special education at the school district, but we provide the information. So as we're working with students right now and we're identifying activities that they could participate in, we share all of that information with the IEP teacher. So we do help gather data that they need for decision making. We help gather assessment information that we're doing, and we share that with the team so that they can help identify and write those goals. They do identify under linkages that if a student is connected to VR services. Going forward, I'm actually part of the new IEP system, the group that is helping roll that out. And they've gotten a lot of feedback from us on how they can incorporate more of the PREETS language and the VR language within the IEP. That PREETS agreement that I mentioned too is going to be part of the IEP system as well, so that we can get students connected better to the system, but that the language will be cross-referenced between the IEP and then VR services. So those are things that we're working towards, but we very much are listed under linkages. They also put a lot of our information under activities. When it comes to the goal areas, it's typically we're sharing all the information that we're gathering and all the data, the assessment results, any other type of activity information that we have, we're providing that to the team, specifically to the teacher, and they're the ones incorporating that into the goals that they're writing and then the progress monitoring of those goals.
Got it. Okay. So it really is a collaborative effort.
Yes, very much so.
We have another question from Sharon. How can parents participate in the parent group that you had mentioned earlier?
So the parent panel, it's known as SEEP. It's the Special Education Advisory Panel. It actually is a panel that reports to the governor. And so Barb Guy oversees this along with Nancy Ankeny Hunt. And it's an application process where they apply and then the individuals are interviewed and then they are selected to participate on the panel and represent different parents across the state. So I would say if somebody was interested in being on that panel, I would definitely recommend them to reach out to the Department of Education, specifically Ankeny Nancy Hunt. She is the one that oversees getting those applications. Then it's actually a group of the parents that are on this panel that reviews the applications, and then they proceed with the process from there to identify and nominate people to be on the panel. And so then when people are on there, there's a term of years that they serve, and then new people are brought on. So there's constantly people coming on and leaving every year from the panel. So we constantly are getting new perspectives on it. But that is Department of Ed, Nancy Ankeny Hunt, would be the individual that you would want to contact if you were interested in being a part of that panel.
Thank you. And then I can send
problem.
information out to everyone in a follow-up email. So it looks like we don't have any more questions in our question box. But I wanted to thank Mary so much for her time and for her preparation in this. And also thanks to everyone for attending this webinar and taking your lunch hour to do so. I'll be sending out a follow-up email after this webinar with more information about how to receive credits. Also, the PowerPoint that Mary shares with the links in it, as well as a link to the webinar recording if you wanted to share it with any of your staff that weren't able to attend or to reference back. So thank you so much and have a great rest of your day.
Thank you.